Hey folks, today we'll be talking about ABG and we'll be talking about what it is, why and when do we do the test, and how and where the test is performed. So ABG stands for arterial blood gas, and we will be measuring the gas that is found in the blood, that is found specifically in the artery, and hence the term ABG. And we'll be measuring three things. The first thing is the pH, the second thing is the CO2, and the third thing is the bicarbonate. So why do we do the test for ABG? Well, there are two reasons. One is to monitor the oxygenation and ventilation level of patients, and two, we want to know the acid-base balance. So in other words, we want to know how well is our patient breathing or not breathing, because that ventilation has a direct impact on the level of oxygen in the blood. So ABG can be used to measure that. And then we also want to know if our patient is in an alkalotic or acidotic state. So when do we do the ABG test? Well, when there's an indication that our patient may be in a state of hypoxia, meaning the patient could be experiencing a low level of oxygen in the tissue, or two, the patient could be in a state of hypercapnia, meaning the patient could be experiencing a high level of carbon dioxide in the blood, or three, there could be changes in the O2 saturation. So a few things to keep in mind is that there are certain medications and medical intervention that could lead to changes in the level of consciousness for the patient. And that change can have a direct impact on the patient's drive to ventilate. And that drive to ventilate can have a direct impact on the level of oxygen in the blood. All right, so let's talk about why and how we do the Allen's test. The reason why we do the Allen's test is to make sure that there is sufficient blood flow through the ulnar artery. And this is to make sure that there is collateral circulation to the hand in the event if the radial artery spasms or is damaged. So typically to do the Allen's test, we have the patient clench the fist, and then we are going to apply pressure on the radial artery right here. And we're also going to apply pressure on the ulnar artery. After that, we're going to have the patient unclench the fist, and then we're going to remove pressure from the ulnar artery. And we should see blood flow to the hand. Once that circulation is confirmed, then we place the catheter into the radial artery right here, and the blood will be drawn and sent to the lab for testing. So typically, the radial artery is the most common site to do the draw because it is easily accessible. But sometimes they also use the brachial and the femoral artery. But typically, those two sites are used in emergency cases only. So let's talk about pH. So what is pH? Basically, pH is a measurement or an indication of how much hydrogen ion or acid concentration in the body. So in a normal human body, the normal pH should be around 7.40. So it should be somewhere around here. All right. So I just want to take a few minutes to talk about the relationship between pH and acid. So anytime when you see the pH decreases, it means the acid level is increasing. And when you see the pH level rises, that means the acid in the body is decreasing. Okay, so they have an opposite relationship. All right, so let's say when there is too much acid and too little bicarb in the body, the pH will continue to decrease. And if it past 7.35 or less, and if it's not corrected at that level, then the body is going to go into an acidotic state. And if the pH continues to decrease, and if it reaches 6.8 or less, and if it's not corrected, then the patient will die, because at that level, it is considered incompatible with life. Okay, because the human body cannot survive at this level. Likewise, if the pH continue to increase, and when there is too much bicarb or too little acid in the body, then if the pH reaches 7.45 or greater, and if it's not corrected, then the body will go into an alkalotic state. And if it continues to increase, and if it's not corrected, and it reaches 7.8 or greater, then the patient will die. Again, because at this level, it is considered incompatible with life. Okay, so the goal for the patient is to stay in a homeostasis state where the pH is around 7.40 or anywhere between 7.35 and 7.45. Let's take a look at the PaCO2. So PaCO2 is the measurement of the partial pressure of carbon dioxide in the artery. Okay, so why do we care about the pressure? Because the pressure determines the gradient of molecules exchange. So let's take a look at this picture right here. We have the alveoli right here. We have the O2 molecules, the green one, and we have the carbon dioxide molecules, the blue one, and then the capillary. So we know during ventilation, the carbon dioxide molecules are being exchanged for the O2 molecules. Okay, so we know the carbon dioxide are being excreted by respiration, and then the O2 molecules are being transferred in the arteries to the rest of the body. So there are certain conditions that will affect that pressure that can have a direct impact on the gradient, such as COPD, asthma, head injuries, drug use, neuromuscular disease such as ALS, or low hemoglobin concentration. So all these can change or can affect how much the CO2 molecules are being transferred from the capillary into the alveoli. So we know if there are too much carbon dioxide molecules in the artery, that can lead to acidosis. And if there are too few carbon dioxide molecules in the artery, and that can lead to alkalosis. Well, let's take a look at the bicarbonate. So what is bicarbonate? It is a byproduct of metabolism. So in other words, when the body metabolizes, it produces bicarb. So one thing to note is that the kidneys and the lungs, they are always working together to correct the imbalance. So when there's too much acid in the body, the kidney is gonna remove the hydrogen ions, which is acidic, and excrete it out from the body as urine. And it's gonna reabsorb the bicarb back into the body, okay, to help the imbalance. Likewise, when there's too little acid in the body, the kidney is gonna produce or generate more hydrogen ions to produce more bicarb, okay? And then for the lungs, when there's too much acid in the body, the lungs is going to convert the carbonic acid into CO2, and it's going to get rid of the CO2 through ventilation out from the body. And then in this way, the lungs and the kidneys are always working together to balance the pH. And the lungs works a lot faster than the kidneys. Usually it's almost immediately the lungs can correct the imbalance, whereas the kidneys can take a few days to do that. If we put the numbers on the table, it will look like that. So if the number falls between 7.35 and 7.45, then we can say that the pH is normal. But if it falls smaller than 7.35, then we can say that the patient is experiencing acidosis. Or if the number is greater than 7.45, then we say that the patient is experiencing alkalosis. And the next column we see is PaCO2, and this is measuring the partial pressure of carbon dioxide in the artery. So this column here, it tells us whether it is respiratory related. So if the number falls between 35 to 45, then it is considered normal. And if it's greater than 45, then the patient again is in an acidotic state that is related to respiration. And if the number is smaller than 35, then the patient is experiencing alkalosis that is respiratory related. And in the next column, we have the bicarb, and if it falls between 22 and 26, then we can say that it is normal. And if the number falls less than 22, then we know that the patient is experiencing acidosis that is metabolic related. And if the number is greater than 26, then the patient is experiencing alkalosis that is metabolic related. Alright folks, thank you so much for watching, and I hope this helps. And if you like the video, please give a thumbs up and don't forget to subscribe. And I post new video weekly. And till then, I will see you on the other side.